Fox Focus. A few minutes for a closer look.
Thanks for joining us for Fox Focus. I'm smiling for two reasons today. One, because we're talking about your smile, and two, because National Ice Cream Day is coming up on July 19th, just a couple of days away. But for some people, ice cream does not make them smile. They might have sensitive teeth. If you're one of them, we brought in some help for you today. Dr. Angela Lueck is with us, a general dentist. Thanks for being with us.
Thank you for having me.
National Ice Cream Day. Ice cream in and of itself kind of makes some people cringe because they have sensitive teeth, doesn't it?
Yes.
So let's talk first about what actually is sensitive teeth, or what the cause is.
If you think of a tooth having three parts, in the center of the tooth where the nerve is provides sensation to the tooth. Okay. Around it is a layer called dentin, and it has little tubules or tunnels in it that can be opened up, especially if the enamel, which is the outer layer of the tooth, the strongest part, almost the armor around the tooth, if that is worn away, you can end up with open tubes into the center of the tooth where the nerve is, and that produces sensitivity.
It doesn't sound good.
It doesn't sound good.
But what can cause that?
Worn teeth from clenching and grinding. Aggressive brushing can cause it. You could get sensitive teeth from gum disease. So if you're not taking proper care of your teeth, if you have recession, so your root is exposed, that will make your tooth sensitive, especially to cold and decay. If you have a cavity in your tooth, you'll definitely have sensitivity.
And cold isn't the only thing that people are sensitive to, is it?
No, you could be sensitive to heat as well, whether it be foods or beverages. You could be sensitive to biting, if you have a crack in your tooth, for instance, and you could be sensitive because of a cavity, so sweets can cause this sensitivity as well.
Well, cavities are certainly treatable, and these other conditions sound treatable as well.
Yes, so and it depends on what the root cause is, and that dictates the treatment we provide. So first and foremost is just proper brushing technique. If you're brushing too hard, you can brush your enamel or that protective layer away. Right. So take a look at your toothbrush. You should be using a soft toothbrush, brushing the teeth gently, and that the bristles are standing straight up on your brush, no bends on the end. If they're bent, it's time to replace it. So pay attention to your toothbrush and replace it frequently. You want to floss as well around the tooth and keep it clean. If you have a crack in your tooth, that can cause sensitivity, so sometimes you need a crown, an inlay, or an onlay. If you have a cavity, it's easy to treat. You remove the decay and you place the filling in the tooth. Sometimes if you have root sensitivity, the sensitivity can be treated by desensitizing toothpastes, which you can get at the pharmacy or the grocery store. Keep in mind they take about 7 to 14 days to work, so it's not an immediate thing, but there's ingredients in the toothpaste that block those pores or little tubules into the center of the tooth, and it desensitizes the tooth. If that doesn't work very well, the dentist can provide fluoride topically applied on the tooth, and that can decrease sensitivity. Using fluoridated toothpaste as well at home is really important to help with that. And then also sometimes you have to apply topical desensitizing medications at the dental office. And if you do have root exposure where there is no enamel, this protective coating isn't present, that can cause really severe cold sensitivity. You can desensitize these areas with fluoride, but sometimes you need a graft where you put the gum tissue back where it belongs on the tooth, covering up that root and protecting it.
So there's help. There's definitely help. And I imagine general oral hygiene is going to be a key to success too.
Very, very important. So being sure to use a soft toothbrush again, making sure the bristles are in good condition, brushing for 2 to 3 minutes twice a day, and using proper flossing technique, going between the teeth, going back and forth with your floss, forming a little C shape around the teeth to clean things really well underneath the gum, and that works nicely.
And see your dentist. And you can find a dentist at wda.org. Thanks for joining us, and thank you for watching Fox Focus.
Interested in appearing on Fox Focus? Email us at foxfocus@fox6now.com.